Yeah.
Oh.
Hi, Joan. This is Kathleen Peachman and Caitlin Driscoll, and we were studying pertussis and the vaccine for it for young children. So there are different kinds of immunity, and they fall under natural and acquired. So natural is the stuff that we're born with, innate or inborn, and acquired is us getting the vaccine or the immunity to the disease. Could be in different ways. So passive artificial immunity is antibody transfer, and it acts immediately, but it's short term. There's also active artificial, and that's an immunization with a live vaccine, like pertussis. And then passive natural, which is passed from the mother to the baby, and it can be passed through the umbilical cord or through milk when she's breastfeeding. And also active natural, which is from exposure to the disease or the infection. So there's lots of different kinds of immunity, and each of us has different amounts of each. So why are vaccines important? There's lots of different reasons, but one of the main things is that it just protects you and your loved ones from preventable diseases. And it might not be because you will get sick, but if you get the vaccination, then you could be protecting your children, your grandparents, the more vulnerable people in your life. So it might not be personally for you, but it will be helping your family and friends. And so how do vaccines work? Well, the body recognizes the germ in the vaccine as foreign, and it sees that it doesn't belong in the body. And so the body ends up making antibodies to fight off the germ. And then as a result, the body remembers the germ and how to destroy it for future attacks. And so when you're exposed to the disease again, the body can defend itself. So there are different ways of storing vaccines, and there's a couple do nots and there's a couple do's. So for nots, it shouldn't be in the door of a fridge or freezer. It shouldn't be near cold air vents in the fridge or in storage bins, and it shouldn't be refrozen after being thawed. A should is it should be in a fridge about 1.6 to 7.7 degrees Celsius. A definition of pertussis is it is a disease of the respiratory tract caused by Bacterium Bordetella pertussis, and it's found in the mouth, nose, and throat of the infected person. And another name that we know it by is whooping cough, and that's what people usually refer to it as. And it is very contagious, especially among young children. Signs and symptoms, it begins like a common cold, and with the sneezing, coughing mildly, runny nose, maybe a low fever. But within 2 weeks, it gets quite a bit worse. So you get a bad cough, and the cough ends in a whoop. The coughing spell, when you're coughing, you can hear a whoop in their voice. And there's thick, clear mucus that they have with it. An incubation period, how long it takes for the person to show the signs and symptoms, even though they still have it, they're contagious, usually 9 to 10 days. Mode of transportation, well, there's parents and siblings can be very instrumental in having it go to the younger children. And so, like I said, it might not be that you'll get it as a parent or an older sibling, but you need to protect your babies and your young children. And so it's also by the respiratory route, and it's through contact with droplet formations. So we know that as indirect contact, and that's the precautions that we would need to have. There need to be droplet precautions And that it's a very destructive disease to young children. So we need to make sure we have those precautions in place when they come to us in the hospital. It's not just touching something they touched, or touching something they will touch, but it's through something maybe they coughed onto. So how long is it contagious for? Well, it can be spread to others for up to 3 weeks after the coughing spells begin. And so that's quite a long time for someone to get sick. So we need to make sure they're being protected during that time and protecting others as well around them. Prevention, well, the best way of preventing is getting immunized and getting the vaccine for pertussis. And of course, there's other ways of prevention as well. Hand hygiene, for instance, that's a very important one that we should be doing on a hourly basis. We need to be washing our hands, and not just washing it just to maybe get by people that might be watching us, but we need to make sure we're scrubbing very thoroughly, and just being sure when we are coughing, if we do have just any cough at all, cover your mouth. And if you're sneezing, cover yourself. Like, make sure you have a Kleenex if you can. And then as soon as you're done, go wash your hands and do it really well. And just hygiene in general, because we have those bacterium on us, and so we need to make sure we're washing it off. So even maybe hugging a baby, it might contact them, and then they could get it, and it could be very awful for them. So treatment is antibiotics, because it is a bacterium, and so we give them the antibiotics, and it's very important that they finish out the dosage. They can't just stop when the symptoms stop. They need to continue until until the full dosage is finished. And it's not just for the child with pertussis, it's also for the family and anyone that has been in contact with them. And the treatment usually lasts about 10 days. So 2 nursing interventions. Well, the big one is teaching hand hygiene and covering your mouth when you're coughing or sneezing. And that one can be taught to children, it can be taught to adults. It's really not that complicated, but it's very, very important for the health and safety of the children. So the second one is teaching the importance of taking the full prescription. Don't just stop when the symptoms disappear.
All right. And I'm going to talk a little bit about the vaccine used to help immunize against pertussis. So they use the DTaP vaccine, and it can be given by your family doctor or by public health. It's given by an IM injection, so it's just a needle. And it's been used since before the 90s, and the last reported case of pertussis was actually in St. John about a week ago this year. So the DTaP vaccine protects against a few different ailments. It protects against polio, tetanus, diphtheria, and infant hemophilus type B, and pertussis. So this vaccine is a part of your routine immunizations from when you're 2 months old up until pretty much the rest of your life. It's usually good for about 10 years. So once you've had your initial doses, then after that you should get it about every 10 years or a little bit more if you're around people that are higher risk. So when it's used as recommended, it's effective up to 85% of the time. So that's really good for little kids, babies, even the elderly. So you get your first shot around 2 months, and then 4 months, 6 months, 18 months, and usually it's given just before school. So people coming in from other countries, like immigrants or older adults that haven't been vaccinated before, they're usually given the vaccine just as a precaution. And at 15 years, you usually get a booster, and a booster is recommended every 10 years after that. So this is a very safe vaccine. There's not a whole lot of cases where people have bad reactions, but there are common reactions such as mild pain, swelling, and redness in the area where you got the shot, a fever, a rash, low appetite, and being fussy and drowsy shortly after. So it's recommended to just give acetaminophen for the pain and fever. And serious reactions include high fever, excessive crying for more than 3 hours, seizures, increased pallor, hives, facial swelling, and trouble breathing. So if the serious reactions occur, you should seek medical attention right away. So almost everybody should get the pertussis vaccine, but especially infants and young children that have never had it, adults and immigrants that have never had it, and pregnant women that are 26 weeks along or more who are due for their booster, and people with regular contact with infants. And there's not really a whole lot of people that shouldn't get it. Just if you go to get it and you have a high fever or you're sick, severe allergy to other antibiotics like neomycin, streptomycin, polymyxin B, or you have an anaphylactic reaction to anything in it, and obviously if you're allergic to any ingredient in it. And that's pretty much it for people who shouldn't get it. So unless you're severely allergic or very sick, you should definitely be getting it. And for interventions, for the common reactions, you can just put a cold cloth where there's swelling and pain on the injection site. You can give acetaminophen for a fever, or just let them rest, because if they're drowsy and fussy, they're probably just going to want to go to sleep. And that's pretty much it. For the serious reactions, if they have any problems breathing, any seizures, anything that would be more significant than a slight cold kind of thing, definitely get them to emerge or call an ambulance, because if they can't breathe, that's a whole other problem. And the myth that we chose about vaccines was that vaccines cause autism. They do not cause autism at all, and they just cause immunity. So that was our presentation on pertussis.